So most of us are pretty comfortable using an NMES device to facilitate muscle contractions so that we can dump lymphatics, decongest, enhance and speed recovery processes, right? We're down with that, and there are a lot of good NMES devices that do that. Oftentimes, if your NMES device, like this H-Wave, has a high frequency setting, then we also have a mechanism by which we can help people manage painful situations. So we can switch from this kind of non-fatiguing muscle contraction, which is very comfortable, and in this situation, this is set at 2 hertz or 2 beats per minute, or per second rather. And what we can do then is we can actually switch to high frequency. And basically, wherever you have the 2 pads, between the 2 pads will create current that can create a numbness or an analgesic effect, right? It can give us some real relief. So when we can run this through a painful joint, after hip surgery, we put one on one side, we put one on the other side, and we can really give the brain a break in terms of what's going on and how it's perceiving what's happening downstream. And that sometimes can last hours after that initial dose. So on-demand pain relief is key. But that high frequency also can be used when I have an athlete who's in lockdown or spasm or protective spasming. So oftentimes we're on the spine, particularly if we get a joint to end range and we start to lose control there, the brain will go ahead and just turn on a lot of the associated musculature into sort of a tonic lockdown. And that's very different. It feels like backyard, the low back barbecue, feels like back bake out. When you feel like you're in spasm or when someone's in chronic pain, there's no getting around that. And if you talk to a physician, they'll say, hey, this is a great use for a muscle relaxant. You might see things like Valium or some other kind of benzodiazepine in there to try to bring down that sort of resting tone or background tone. I'm not a physician. Our acupuncturist friends or biomedical acupuncture might use needles to help break spasm. Works great, break high tone. You've seen constant pressure as another way to break high tone. One of our favorites is actually the first time I heard about this is to create an isometric, or what Pavel described as a shutdown isometric, that if you just made the tissue work hard enough, long enough, eventually it fatigue out and let go. And he was using that to sort of restore positions around doing things like the splits. But in this situation, what we've got is high frequency, which allows us to actually break that high tone or break that spasm using electricity, in this case the high frequency mode. And then what ends up happening there is that we can, once we start to get 30 to 45 minutes of input in here into that lockdown, we can then, we'll see a break in tone, the tissue will start to relax, muscle starts to relax, nervous system starts to downregulate, threat response, and then we can switch back to pumping. But oftentimes what's happening with NMES is that people are using NMES and trying to pump out tissues that are in sort of neurologic lockdown. So what I've got here is I've got Diane set up here. I'm going to turn the unit on. And in this situation, normally what we would do is we would hand the unit to our friends and say, hey, I want you to dial this up right before you get into a full lockdown, right? You'll feel that little pump. So I'm turning on high frequency here, but I'm going to turn it up a little bit. And what you can see is that we're adding some, and then boom, her erectors jump. So you can see erectors on, erectors off, erectors on, erectors off. And so what I'm trying to do is just have her comfortably adjust this. And in this situation I'm doing it for her, we've already talked. And I just turn it on so we start to get some tone in there. It doesn't have to go to 10. That's not the point. I can basically get Diane to arch off the table if I dial this up enough. But the idea is to try to get just a moment where we can start to pick up some tetanus in that tissue, where the model is trying to, or the muscle is trying to basically go into lockdown. So right now, I'm basically signaling that muscle, get into that isometric, start firing, and it is, and you feel that, yeah? Is it comfortable? Yes. So what's nice is that we can go across the spine, we can go up and down. It matters less. You can even go diagonal. But the idea here is I have a single lead, and some of these devices have one lead, some have two leads. In this situation, I've got a single lead, and I'm just going on either spine. And what's happened now is she's already acclimated and accommodated to that level. So I'm going to just go up a little bit higher. This is why it's important that she could access this. And now we're back into that high tone. And again, what we would do is say, hey, let's rock this for 30 to 45 minutes max, so that the tissues don't get irritated underneath the high frequency, and then let's see how we are. And what will end up happening is, again, using this high frequency mode, we can break spasm, get people then back into a good old-fashioned pump mode where we're getting some movement in here. And once we've broken that high tone, then we can get about restoring blood flow, getting the release of the nitrous oxide, all of the downstream effects. This is one of the ways that we handle these acute situations. Instead of necessarily having to onboard with drugs or having to onboard with needles if we don't have access to them or aren't licensed with that we can use this same device that we're using to help manage persistent pain, chronic pain, or for muscle neuromuscular reeducation or for decongestion, and it can be repurposed in this situation to help someone feel better so that we can get them going again. Because oftentimes, if she, let's say, caught a heavy clean or heavy snatch and just went to end range, we can be getting those cues. Nothing is damaged, nothing is wrong, except that the brain is saying, hey, I didn't like that position, let's lock down. So now we can be getting Diane out of that back kind of lockout cycle and back to training more quickly. So this is how we use high frequency to break spasm.